Okay, Dr. Tan, thank you so much for joining us today as we participate in National Month of Action. Joe Biden is doing a big push to get 160 million Americans vaccinated by July 4th. So we want to do everything that we can to help in that effort. So basically, if you could give us your background really quickly, and then we can go on into some questions.
Sure. I'm Michael Tan. I do infectious disease out of Summa Health in Akron, Ohio. I'm a I'm professor of internal medicine at Northeast Ohio Medical University. We've been fully involved with the COVID epidemic and continue to see COVID cases as we speak.
So in general, why would you think so many Americans are adverse to getting the vaccine? What is one of the biggest concerns that you think that they have, and what would you say to appease them?
Well, I think, not even necessarily being specific to COVID, there is a lot of vaccine hesitancy for a lot of conditions. I mean, certainly there are vaccinations available for influenza, pneumococcus and pneumococcal pneumonia, varicella, et cetera. And if we just take a look at influenza and influenza vaccination rates, they're overall not very good. But when we take a look at, so I think when you introduce a new vaccine, like the vaccines for COVID, I think there's a lot of concern about, how much has it actually been tested? What are the potential long-term side effects from it? Is it new technology, or is it something that has been around for a while?
Mm-hmm.
So we definitely saw people who were trying to, wait around for more conventional vaccines, passing the mRNA. I've definitely heard from people who have said that they wanted to see how it went with other people getting it before they actually got it.
Right.
I've heard people who say they wanted to wait on a little bit more long-term data. But I think one of the most important things that comes up is that if we look at the as the vaccines really got rolled out and people were really picking up on the number of vaccines that were there, we're now into the hundreds of millions of vaccines that have been given in the United States, not to mention worldwide.
Mm-hmm.
And the overall tolerance to it, and I'm trying to think of the right word for it, the overall acceptance of it with really, and the safety has been demonstrated. Yes, there are adverse effects that you can associate with any sort of vaccine,
Mm-hmm.
or intramuscular injection. But when we look at a lot of the things that people are concerned about and that come up in the news, what's really important to know is that those adverse events are happening at rates that are typically less than you would see if somebody otherwise got COVID, or
Right.
Or naturally occurring events such as would be described with the vaccines.
And this vaccine has been in the works for quite some time. So it's not just something that scientists threw together within a year. It's been studied for a while. So that should help out with a lot of people's concerns as well, I'd imagine.
Correct. mRNA technology has been there for a while, and it's really just a matter of attaching the appropriate mRNA to get the target manufacturing that you're really looking for. And when you think about the mechanism of mRNA vaccine, that's really, I think it's fascinating. It's a completely separate topic of discussion. When you talk about some of the like the Johnson & Johnson vaccine, which is a little bit more conventional, I think, for people, that's technology that's been and practice that's been around for many, many years.
What are the side effects, mainly the major ones that people can prepare for when they do go, in fact, get the vaccine?
Yeah, I think that's a good question, and it's really important that people know what types of things to expect, because it's rare that a vaccine that people will get an injection that they're not going to have any side effects. But the most common things that people are going to have are injection site reactions, and that's mostly pain at the injection site, sometimes some redness, and sometimes swelling. Commonly seen with the vaccinations, usually happening within the first day, is that some people will start to feel some fatigue. They'll be a bit tired. Some people will have fevers, some people will have chills, and some people will have muscle aches as well as nausea. For the most part, I would say that most people will have those side effects for about 48 hours, up to 48 hours, and then it tends to disappear. But that period is generally the time when it's worst for patients after getting the vaccine.
What about with expectant mothers? Would you still recommend them getting vaccinated? I know they probably have, some larger concerns with it and how it might affect the babies. So what would you say to them?
So absolutely. So the first thing that I think that we want to address there is that all of the vaccines that are available are in no way tied with any risks of reproductivity or fertility.
Okay.
So we should definitely put that to rest. There is no effect on genetic material. There is not going to be any change in DNA. And if we take a look at the recommendations that are actually out there by ACOG, the American College of Obstetrics and Gynecology, the recommendation is that for pregnant patients or patients who are going to become pregnant, that the vaccine should be given unless there is otherwise a clear contraindication to do so. So the recommendation is if somebody is pregnant that they should receive a COVID vaccination.
And what about
other things to also consider is that the antibodies generated by the vaccine have been detected in breast milk. So there is definitely a thought that there probably is some transference of maternal antibodies within the milk as well as in utero for the baby.
Okay. No, that's really good information. And what about children? Are you seeing a heavy push for children to get vaccinated? And would you recommend that as well?
Absolutely. Children should be vaccinated. And currently Pfizer is the only vaccine that has an emergency use authorization down to the age of 12. You can expect similar symptoms, but I think it's important to vaccinate children, especially because while we know that a lot of them don't really have significant symptoms of COVID, there is always the possibility of asymptomatic transmission. And I think we've been seeing a lot more kids who have been admitted to the hospitals with more symptomatic COVID. And that may be because, we've kind of sort of pushed the COVID to the lower age groups because a lot of the older groups have been vaccinated. But that also can be attributed to the fact that we are seeing more of the variant strains that can be coming up. It's a very interesting question to me as to how many kids may have already had exposure to COVID.
Yeah.
And we don't really know the answer to that. And because we don't know the answer to that, it is very important that kids who are eligible get vaccinated and everybody else get vaccinated also to help reduce the possibility that the variant strains will actually become a problem for all of us.
Okay, and you kind of answered my last question, the variant strain. So is the vaccines that we have out now, those are for the most part effective against those strands? Okay.
That's correct. For the circulating variant strains that are there, the vaccines that we have available in the United States right now are considered to be generally very effective for those variant strains. And to help, and of course, the idea there of preventing the variant strains and preventing any COVID so that you're actually preventing the development of other variant strains, which may potentially then become not affected by the currently available vaccines.
That's a really good point. Well, thank you so much for your time in educating us on the importance of getting vaccinated. Is there anything else you would like to add in general about the effort that a lot of Americans are participating in?
I think it's important to be sure you go out and get your vaccine, and there's still a lot we don't know. So heed the science, and if a booster becomes necessary, get the booster. And use common sense. So while a lot of our mandates have gone away with respect to masking, I think it's important to maintain COVID precautions, even with vaccination, especially if you're in situations where distancing may not be possible or where the overall vaccination status of your situation may be a little bit questionable.
Yep. Absolutely. Well, thank you so much, Dr. Tan. I appreciate your time, and you're driving to Columbus. So I wish you a safe drive and a good weekend.
Very good. Thank you. You too.
Have a good one. All right. Bye.
Bye.